everybody, welcome to another episode of Drug Talk. As always, I'm your host, Gary Campbell. Today we're going to be discussing a medication known as Escitalopram or Cipralex. This medication is typically used for depression or anxiety. Now before we get started, just be aware that this channel is to be used for information purposes only and not as a source for recommendations for your personal health care. If you have any questions about medication, just direct them towards your personal healthcare provider. So Escitalopram or Cipralex is taken orally in tablet form, and we see it available as a 10 milligram and a 20 milligram tablet. The class of medication is known as an SSRI, or Selective Serotonin Reuptake Inhibitor. Before somebody was to start using this medication, there are some contraindications that a patient would have to make sure they're clear of. One contraindication would be if a patient was to have used a monoamine oxidase inhibitor within 14 days of escitalopram. The reason for this contraindication is that if you were to use these two medications together, you could experience what's called Serotonin Syndrome. This is a very serious reaction which starts off to present with flu-like symptoms, but it becomes very serious and requires hospitalization. Now, if an individual was to experience Serotonin Syndrome, keep in mind that this syndrome can happen if you were just taking escitalopram or another SSRI. Some of the symptoms you may experience are agitation, changes in mental status, myoclonus, hyperreflexia, tremors, and diarrhea. Severe cases, when left untreated, can develop into rhabdomyolysis, seizures, and even respiratory arrest. Some of the following things to consider are not necessarily contraindications, but precautions. As with all SSRIs, escitalopram or Cipralex does have a risk of inducing mania in individuals who suffer from bipolar disorder. Occasionally, in these individuals, prescribers may choose sertraline over escitalopram. It's also important to consider that the induction of mania in these individuals may be dose-related. Using this antidepressant, there is a risk of self-harm. Of course, the purpose of this medication is to alleviate depression and move people towards a place in their lives where they won't experience self-harming thoughts. However, it does occur from time to time when people start on these medications. This is why it's important to have a very rigorous monitoring plan when somebody's starting a new antidepressant medication, especially if they're an adolescent. It's important to note before starting this medication that there are withdrawal symptoms that can occur if you stop the medication abruptly. These usually aren't reported to be severe or very troubling. However, in some individuals, it can cause some concern. Symptoms, if they were to occur, would typically start within 1 to 7 days after discontinuing an SSRI, depending on which medication in the class it was. People may experience headaches, fatigue, nausea, and occasionally insomnia. It's less common that something like visual disturbances would occur. For this reason, it's important to taper medications like this instead of stopping them cold turkey. And by this, I simply mean decrease the dose slowly over time. So after being made aware of the contraindications and precautions, and somebody starts taking this medication, it's typically taken, as I mentioned before, orally as a tablet, once a day, typically at the same time each day if you can manage that. It can be taken with or without food, and there's something really important to note when you first start the medication. Unfortunately, this class of antidepressant takes weeks to find maximum benefit, and side effects typically happen in the beginning of therapy. So for this reason, when people start taking the medication in the first couple weeks, they may be experiencing side effects, but not experiencing much benefit yet. For this reason, many people stop taking the medication thinking that they're only experiencing negative aspects of it. Because of this, it's very important that as healthcare professionals, we tell patients about this so they know that they have to push through those first couple weeks to get to that point where they can actually have a chance of experiencing max benefit. Cipralex is typically started at a dose of 5 to 10 milligrams with a goal of reaching a dose of 10 or maximum 20 milligrams. Of course, this would differ from person to person depending on whether they're treating depression or anxiety and how well they respond to the medication. Now, while you're taking this medication, as with all medications, there are some side effects that you may experience. The most common side effects that happen over 10% of the time are diarrhea, nausea, insomnia, fatigue, nervousness, and sexual dysfunction. With sexual dysfunction, typically with males, we see a decrease in sexual function, and with females, we see a decrease in libido. There can also be some changes of weight associated with this medication. Some side effects or adverse reactions that happen less often, so 1 to 10% of the time, include abnormal dreams, dizziness, abdominal pain, dysmenorrhea, excessive sweating, hot flashes, or joint and muscle pain. Some very rare side effects, so happening less than 1% of the time, would be abnormal bleeding, hypoglycemia, and orthostatic hypotension. That's all I have to say about escitalopram or Cipralex today. As always, just keep in mind, as I mentioned at the start of the video, this video is for information purposes only and not to be used as a source of recommendations for your personal health care. Direct any questions towards your personal healthcare provider. If you're enjoying the videos or find the information valuable, you can like the videos, share the videos, or the most important one would be to subscribe to the YouTube channel. Thanks so much. Take care.